Hello, and welcome to Today in Geography, a podcast produced by the Department of Geography, Environment, and Spatial Sciences at Michigan State University. Each episode, we talk with members of our community about their research and interests, and then we spend some time spotlighting events and celebrations that have shaped the field of geography. I'm Nathan Moore, an associate professor in the department, and your host for an engaging exploration of people, places, and stories that shape our world. Today, we're celebrating the founding of the American Association of Geographers, AAG, which took place on December 29th, 1904, in the city of brotherly love, Philadelphia. But more about that later in our show. First, I'm joined by Katie Brown, a PhD candidate in our department. Katie, thanks for joining us today.
Thank you so much for the invite.
Tell me how you got started in the world of geography.
I appreciate that you started with that question because I love telling my geographer, I don't know, what's it called?
Myth?
Yeah. It's not my villain origin story. It's the opposite of that, right? So I went to the University of Kentucky and I was undecided when I started school. So I was doing all my core requirements, which some people lament, but I think is a really valuable part of undergraduate education. And my first semester, I took a geography course, and I had a really important, ended up being sort of a mentor of mine, Dr. Lynn Phillips. And so I took a geography course that fall, and then in the spring, I learned that the major of undecided was being canceled, basically. So you had to pick a track. And I was like, well, I don't know what I want to do yet. And I was sitting in a anthropology course, and I was talking to the people around me, and they're like, well, what classes did you like last semester? Maybe you can just, pursue that further. And so I was like, well, I think that the only class I've enjoyed in college so far was my geography class. So I met with Dr. Phillips again and discussed what it would mean to be a geography major and what I might be able to do with that sort of knowledge base. And I became a geography major.
You didn't choose geography out of panic.
I was a little panicked.
Okay, a little bit.
But I also have been told a million times by my mother that you should change your major 15 times. So
That's actually a good point.
yeah, so I wasn't afraid of picking something I wouldn't like because I had a few more years to make a final decision.
Okay, and when you started looking around in your senior year, I guess, what sort of things were you thinking about for your next steps after getting your BA?
Yeah, so I grew up in a very healthcare-oriented community. My father was a physician, my mother was a nurse. So while I was a geography major throughout my undergrad, I was pre-med as well. So I'd taken all of my biology and chemistry and biochem and all of those things. So it was actually probably my junior year when you start thinking about studying for the MCAT, which is more of a decision, if you're going to invest the intentional time to study for a test to enter into medical school. That I was like, do I really want to be a doctor, or am I just kind of having that as a fallback plan? Not that it's a fallback plan, but, like I took the courses because I could take the courses and they went towards a degree. But it was then that I really decided I wanted to be a geographer and really make a career out of it, because at the time I was a part of a pre-medical organization on campus, where they would bring in people every week to talk about medicine. They'd have cadaver labs for undergrads. They'd have the dean of the medical school come and talk. And so it was actually during my junior year, they had the dean of admissions for the University of Kentucky Medical School come and speak to us. And he said something that really sat with me, that kind of pushed me in the direction of, maybe more than just practitioners can change how people's health is and how people experience the world. And what he pointed out was that in Lexington, Fayette County, they are actually labeled as medically underserved. And that feels very perplexing because if you're on the University of Kentucky campus, there's actually 5 hospitals within less than a mile. But actually for the county as a whole, because of accessibility issues and opportunity to get to a hospital and receive care, the community is underserved. So having continued to take all these geography courses throughout my time at Kentucky, I was like, well, that's a geographer's problem. Like we can understand and try and support people that maybe don't have proper access to the healthcare they need. So then I started thinking, okay, I should probably figure out what it means to be a geographer. What do I need to do to do that sort of work to explore, and like better policies and ensure more equitable healthcare for people in whether it be urban or rural areas, I guess.
So that really ignited your idea that there's some patterns going on in space and maybe through time as well.
Yes, definitely. They support one another.
Yeah. And that's an important part of delivering good health care. So what ended up making you get interested in coming to MSU for more education?
Yeah, so I decided that I should probably at least pursue a master's at some point in time to be able to like serve in a larger capacity and in a government institution or something of that in like the CDC or something. It was definitely not my plan out the bat. I'm a May 2020 graduate, so I had an internship lined up to work for Fayette County in Kentucky and was really excited about that, but then the pandemic had other plans. So I ended up back in South Alabama trying to figure out what to do as I finished my college degree and where to go. And talking with, again, some of my mentors from Kentucky in the geography department, they were like, well, there are still programs accepting. Maybe you could fast track your master's plan and then pursue something else down the line. So then I started trying to understand where I might want to continue my education. And to do that, I went through, Google Scholar, tried to find people that were working on stuff I was interested in. And I found a few folks all across the states and abroad. But I realized that looking at their CVs, most all of them had come to Michigan State University.
Really?
So I thought, I'll throw my hat in that ring because it might be a nice, legacy to be a part of.
Okay. And then, so you got here and you're thinking, just get a master's and then move on to the next thing.
Yeah.
And I understand. When I was young, I did 15 different things before I settled on geography. What did you end up getting involved with research-wise when you came to MSU?
Ooh, that is a fun question and something that I wasn't expecting at all. So my advisor has so many projects, so many different interests. And when I got here, I had planned originally to be a part of the MDHHS grant, which was looking at like urban rural health disparities. And I eventually did contribute to that work and we had some interesting findings there. But when I got in my first fall, there was a project that needed doing. So I looked at how access to visual nature outside of classroom windows might impact students' behavior problems in Lansing schools. There were 3 schools in the study. And we had really interesting findings. And that kind of did say like, oh, research is very dynamic and you can do so many innovative things with it. So I think, maybe that started another gear in my mind.
Sorry, I'm a little bit behind the curve here. What does visual nature mean?
So I wasn't there for data collection, but when they were doing the field work, I guess you could say, the year before, they had taken pictures outside of everyone's or all the classroom windows. And then I essentially counted the number of green and blue pixels of trees and sky and grass and different nature types outside of the classroom window. And then we explored, do certain types of nature outside of classroom windows relate to different sorts of behavior problems among the kids? So I don't know if that articulated well, but
yeah, I think I get a pretty good idea of that.
Yeah, it was an interesting approach to trying to measure, access to nature for kids in classrooms, which I was glad to be a part of, especially so early on in my time at MSU.
And then that sort of parlayed into some work that you're doing in Detroit, right?
A little bit. It definitely started an interest of greenness and the value of nature. I'm from a rural place, so I never, I think, really appreciated how important parks and urban green spaces were. And that's definitely a large part of what the lab that I work in does, is looks at access to nature and the benefits of green space, et cetera.
This is the SHAC lab, right?
Yeah.
What does SHAC stand for?
Health and Community Lab.
Thanks.
Yeah. So that's a big tenet of the research that we do. And just to be the devil's advocate, I kind of jumped on the bandwagon of exploring green gentrification, which is like if you introduce green into a place that hasn't had green space available, is there the risk that it might instigate gentrification? And I did want to do some of that work within Detroit. I haven't had the opportunity to yet. I've been more on the soul gentrification angle and urban change. But yeah, in the future, I really am interested in trying to better disentangle this role of greening and urban change and exclusion and inclusion, that sort of.
So there's a lot of
equity.
social issues that are all entangled with the sort of the biophysical landscape that you're living.
Absolutely.
Have some problems or new ideas for work after the PhD come up that you notice, you're like, oh, I should check that problem out, or I should look more into this other funny thing here?
Yeah. I think that once you start working in a program like this, everything becomes a research question, Like it's a little too dangerous at times where I'm like, okay, I'm interested in, neighborhood disorder. I'm interested in neighborhood advantage. And that can be anything and everything. And how do you measure it? And how do you measure the health outcomes? Off the tip of my tongue, what's a question I'm asking nowadays?
Like what's something that's really, you're like, that's at the top of the list?
I am really interested in the value of neighborhood amenities right now. That was my final chapter in my dissertation, was on the potential protective capabilities of spaces that offer community engagement and belonging. So things like rec centers or parks or libraries or things to that end. And in the future, I want to expand on that and look at especially in the circumstance of Detroit, looking at public art, because I think it is quite representative of the historic population, and it's empowering in some ways. There's lots of public art across the city of Detroit that's about empowering the people that have been there, and substantiating that people didn't all leave. There's a really famous mural on Eastern Market that says Detroit never left, literally, and
just
so
money back.
well, just a chunk of the tax base. But yeah, there have been and always will be people in Detroit, and I think that the public art that's displayed around the city might have an important role in retaining people's mental health in the face of the change that's happening, because it is it in some ways embodies the people that never left, it's very representative, I think, of the population. And it's really beautiful, and it's really well appreciated by people, visitors and residents alike. So that's something maybe in the future I can try and dig deeper into.
If I were to take your experiences in Michigan and in Detroit and then pick them up and plop them down somewhere else, where else would you like to look at to apply those same tools, but to look at a different landscape?
I think they can be applied anywhere, and I'm excited to do that. In terms of, I don't know, the value of neighborhood amenities, maybe going back and looking in rural areas, looking in the city I'm from. I actually was surprised and interested. So my work has kind of transformed, particularly in the case of Detroit, to trying to understand how urban revitalization efforts might impact people's mental health, and if it's been overwhelmingly beneficial or harmful, because there's, not a concrete answer to that. And funny enough, last year I got invited back. I'm from a small town in South Alabama, and they initiated a program called Dothan Alumni Cohort. So it's essentially a revitalization effort to try and get young people to come back to our hometown and transform it. And they highlight we just got a new theater, not like a cinema, but they just updated the opera house, basically. We just built this new park system. Yeah. There's a civic center, they're highlighting all these things. And it's really interesting, I think, now with the gaze I have, they're afraid that they're going to, lose too much population, and they're trying to remind people there's value in this city. And there is value. I come from a wonderful, they grow lots of peanuts, and there's a wonderful community there. And maybe you need to be reminded of that to be interested in moving home or moving back.
There's a real theme, I think, nationwide about loneliness and isolation. And I think that larger national dialogue kind of fits really well with a lot of the things that you're talking about in Detroit.
Absolutely.
And also now Dothan.
Yeah.
If you had a young person that you were talking to and they were interested in these types of issues, health geography, green spaces, and that sort of thing, what sort of advice would you give them if they're like a freshman or sophomore in college and they want to go get more into this line of work?
Well, I think that it's nice to try and integrate yourself into some sort of lab. I feel like that was something I wasn't aware of during my undergrad. I do feel like I was so preoccupied if someone had said, hey, do you want to join my research lab? I'd be like, I don't know what that is. I'm fine. So just awareness of the opportunities that do exist within
undergraduate research.
Yes, within these departments, and that can provide, a pair of glasses so you can see these options long term. Like, oh, if I had been in a lab in my undergrad, I might be in a totally different place because I didn't realize this whole world existed where people were studying things in really important ways. And maybe that's me being naive, or ill-informed.
We all are at that iteration.
Yeah, I think that there's I would say, go to a department that you're interested in, and see if there's anyone there that is doing work that you might be interested in, remotely interested in, like just trying to literally dip your toe in a pond to see how it feels would help. Yeah.
So I understand that you've got some work lined up after your degree. Can you talk about that a little bit?
Yeah, so I will start a postdoc, and that is in the College of Human Medicine in the Department of Public Health. I'll be working in a similar capacity, but doing, I think, more analytical work and leading more projects. And that it's exciting but terrifying at the same time, like this hopefully is a terminal degree and I'm gonna be done pretty soon, hopefully. So I'm excited about it. I think it'll be nice, the continuity of being able to finish projects that I've been a part of, as well as contribute to new ones I'm looking forward to doing that. Yeah.
Are there any pieces of research that you've thought of in the last few years that you're like, oh, we need to apply this to Michigan? Is there a Michigan specific or MSU specific kind of line of thinking that you've wanted to chase down?
That is a really intriguing question.
Well, I was thinking about your blue space and green space.
There's lots of blue space and green space.
And we got a lot of water here.
Yeah, we have a lot of water here. To be honest, no, I haven't really thought about that at all. I think that Michigan is interesting because there are so many urban hubs and so much rural space in between. That's something I'm a little bit interested in, is trying to explore potential differences and how people transverse those spaces. I mean, I've been here about 4.5 years, and most everyone that I'm friends with outside of the department, like long-time Lansing folks, live somewhere else and they move to Lansing, and they... a few of them haven't ever even been to Detroit or been to Kalamazoo. It's very interesting.
So far away.
Especially when you have friends like Vasily and they're like, we're going tomorrow. Do you want to go to Traverse City? I'm like, okay, yeah, sure. But so I think I honestly, I don't have a good answer for that question. I don't. There's definitely a lot of work that you could do in Michigan exploring the value of green or blue spaces, but I haven't put much time into thinking on it.
Okay, that's fair. And I was also going to ask you about the demographics of Michigan. I see that if you see the maps, have you seen those maps? There's everyone in the northern half of the state it's being depopulated. They're all clustering in the cities. And so I'm like, do we have enough hospital beds for that big of an increase?
Yeah, the MDHS does check on that regularly. I can let you know, because we're on those emails about, are these hospitals equipped? So
a lot of old people, I think, who are maybe no longer able to live on their own.
Yeah, especially in the UP, actually, I've recognized. There are a lot of older people in the UP.
If you were to summarize the key discoveries of your dissertation research and sort of something that a climatologist could understand. How would you summarize your dissertation results? What's the key take home?
So my dissertation, as I kind of briefly mentioned, it ended up being, I was exploring different urban revitalization programs. Specifically, I did that through qualitative methods. So we interviewed about 25 people and asked them to describe their neighborhood conditions and then recognized what urban revitalization programs would impact those conditions. And then I had another chapter that was looking at subjective understandings of change. So we had a survey where people responded to how they perceived the change in their neighborhoods across time. And then my final chapter was looking at using a quote-unquote objective metric to understand levels of change near people's home and then see if there was a protective effect of the availability of neighborhood amenities nearby. And from all of this work, the findings, don't perfectly align, but they do kind of show that when neighborhoods change, there's not one steadfast, this is good or bad. And it's highly dependent on the actual person, the personal, like the demographics of the person, particularly their, financial stability in the face of changing neighborhoods. But also there are resources available. So I think that's what was really exciting for me was the last chapter of my dissertation showed that when people are in what we call gentrifying based off of a series of variables, when they're in gentrifying neighborhoods, but they have a high level of neighborhood amenities available, considering community centers, libraries, and parks, they actually have decreased anxiety and increased life satisfaction. So I think that there's a lot more work that I can do in that area, trying to better disentangle what might be going on and how the amenities actually are supporting residents potentially. But in the end, neighborhood change, especially in the case of a place like Detroit, is not totally resisted. People in our interviews really said, no, I welcome the change. I want new life in my neighborhood. I want the buildings to be torn down or refurbished. I don't necessarily care who's doing it. I think it's nice to have a full block rather than being, socially fragmented and watching all the houses disappear over time. So I think that it's just still a paradox, and we're going to have to keep digging to get a better grasp on what's going on and who's affected by the changes in what ways.
So, but to borrow from astronomy, there might be like a Goldilocks zone of correct policies and the right investment and green space and not gentrifying too quickly.
Absolutely. I think that that's something, I try to be informed, but I don't want to say something and it be misrepresentative. But I do think that the city of Detroit has been relatively intentional on trying to support existing residents. They have the land bank sells neighboring lots to people who own their home for $100. So you could end up owning all the land on your home, and a lot of people all the land near your home. A lot of people are doing that and turning it into urban agriculture, which enhances food sovereignty. You don't have to worry as much about being able to buy your food, which is a concern when neighborhoods gentrify, that even if you own your home and you can sustain the weight of rising property taxes, that you won't be able to shop at your corner store, so you end up eating poorly or not at all.
Yeah.
So I think there are different initiatives the city has employed to try and do something good in the midst of all this change. Whether or not it will be sustained or, supportive enough for all the residents is, I think, a long-term picture that we can't really see yet.
How has all this work and being a geographer changed the way you look at the world?
That's such a sweet question. I think that it's been shaping the way I look at the world for a really long time. I was talking to a friend of mine in the department. We started at the same time. And I was like, yeah, sometimes I just worry I'm not a geographer enough. Maybe my dissertation didn't have enough space and place and all the keywords. And they're like, no, it has and it always has. When you got here, your proposal was about things in space and
where and why.
Yeah, where and why and who's where and why are they there. And they were like, mine wasn't like that. It took me time to build that. So I think, at this point, oh my goodness, I've been learning with a geographer's gaze for like 8.5 years. So I can't look at anything without considering why it happened there and, what's going to happen next to it because of that.
Okay. Well, thinking about your whole trajectory through the world of geography, is there one sort of lesson that you've learned at some point along the way that's really stuck with you that you want everybody to know? Like my phrases I use in class a lot, it's never just one thing.
Oh.
Easy problems have already been solved. If you find a problem, it's like, it's simple. We kill the Batman. No, it's not simple. It's always a bunch of stuff. So that's sort of my go-to. But
you do have a nice mantra. I could have thought of something earlier.
Well, I just put you on the spot.
Yeah. Let me think about it.
Come back after you defended your dissertation.
Give me like 2 weeks, right?
Okay.
Yeah.
That's fair. Well, thanks for coming in today to talk to us and share your geospatial journey. I know you're going to stick around and chat with us for a little bit about the American Association of Geographers, but first, it's time for a moment from our sponsor. Looking to upgrade your career or gain new in-depth, in-demand geospatial skills? With Michigan State University's OnGeo Professional Certificate Program, you can earn a certificate in GIS, Geographic Information Systems, or geospatial data analytics and visualization, all fully online. Designed by professional geographers, OnGeo courses help you build real GIS experience using today's latest tools and technologies. New sessions start 6 times a year. No long applications or campus commute, just practical skills you can use right away. Visit ongeo.msu.edu to register and start your GIS journey today, or find the link in the show notes to learn more. Okay, Katie, we are celebrating the founding of the American Association of Geographers. Do you remember the first conference you went to for AAG?
Now, when you ask that, are you saying in person or online? Because
that's right.
Yeah, my first year, we were all set to go to New York. And then, unfortunately, because of I think it was the Omicron variant or something in the spring of 2021, they had to move it online. So my first AAG was AAG virtual, but my first in person was in Denver, Colorado.
And that one made an impression.
It made a lasting impression. Yeah, I went to the AAG with a group of other graduate students. Obviously, there were also faculty there, but saw them more in passing. And I also, before going to the AAG, went with my partner to the PGSG pre-conference, which was held in Boulder. And so it was really a beautiful step into what it means to be at AAG. I got to meet people there in a more intimate setting and then go to this huge, 5,000 person conference and see faces I knew, including I bumped into some of my TAs from my undergrad. And I saw some of my old professors from my undergrad too. So it was really, AAG I think is a wonderful organization and has a fantastic annual meeting that we look forward to every year.
Do you ever go to conferences and feel like you learn so much that you need to sleep for 12 hours?
Yes, I do.
I feel
maybe like 15 hours. Yeah.
Yeah, it's a flood of information. And the first time I ever went to an AAG meeting, I was like, that's too many maps. And geography's more than maps?
It's absolutely more than maps.
Well, what do you think the role is for AAG for graduate students? Is it critical? Is it optional?
I really think it's critical. I think going and building the community, making the connections is hopefully serve for a long time. I'll have people to fall back on. I've made relationships that now we're talking about potential projects in the future, and I'm don't have my degree yet. So I think that's really fantastic. And while it is a huge organization, these specialty groups have, a nice feel to them where you can identify a community that your work really aligns with. So I'm a part of the Health and Medical Geography Specialty Group. I go to their meeting, which is every other year, called the IMGS. But it's essentially, it overlays where you see people, and then every time you go, you kind of build a bigger network and you learn a little bit more. And I think that Conferences are one of the most beautiful things, really. Like, I know that people have conferences beyond academia, but especially in the work that we do, it provides a real information share that's very valuable to make sure that knowledge is being pushed forward.
Yeah, it really brings people together. And like little neighborhoods in big cities, I mean, that's in real space, but in sort of parameter space, we have like little groups of climatology geographers and health geographers and physical geographers. And I feel like it's nice to see people who think about the same kind of problems day in and day out and share all the different ideas.
Yeah.
So if people want to know a little bit more about your research, is there like a website or some other place that we could direct listeners to see?
Yeah, the lab that I'm a part of, the Space Health and Community Lab, has a website. I'm not sure the URL off the top of my head, but if you look up MSUSocialScience, it should come up so that you can explore more of the work that we're doing, because there's a lot of stuff going on in that lab.
Excellent. Very good. Thanks. We'll include that information in our show notes.
Wonderful.
Thanks for coming today.
Thank you, Dr. Moore. I really appreciate it.
So that's a wrap for this episode. Thanks for listening to Today in Geography from MSU's Department of Geography, Environment, and Spatial Sciences. Be sure to subscribe and share. And join us next time as we continue exploring the people, places, and stories that shape the world around us.